Now, I took the liberty of passing around those models. If you looked at it, what it is a denture on a model that looks like a mouth with little round things sticking up. And one of them has additional things on it also, and it sort of snaps on. Any of you that know someone that has full dentures, some people do very well with them, some people don't do well with them. Some people do well with upper plates. Dr. Smith, maybe you can back me up on this, but they sure don't do well with lower plates, right? There's even jokes, dentists make jokes about them. You charge them twice for the upper and charge them nothing for the lower. And then when they say, hey, this lower won't stay in right, you go, well, what do you want for nothing? So through the years, as people, if they lose their teeth and they're trying to eat and maintain a diet, now everybody also knows somebody out there that can gum their food and eat just about anything, and it's mind-boggling. How do they do that? I don't know how they do that. But there are people out there that do that. But I would say that's the exception, not the rule. And most people, if they've lost all their lower teeth, they're really in a pinch. They can't eat properly. Their digestion already isn't as good as it used to be. And they don't have a broad diet anymore. They just don't. And so they're forced to either puree their food or they're just very limited. I mean, what they can eat is just very, very limited. And so their health starts to suffer as a result. They just don't get the same nutrition. So one of the ways to address that is dental implants. Traditional dental implants are a little bit wider. The mini implants, and they're known by different names, are slightly smaller and skinnier. And each one has its own use and its own strengths and weaknesses. But the idea is you can use them, they're like roots. Think of an implant as a root. All of a sudden you have a root back in your mouth that you can anchor something to. That's the idea. And if you look at that little model floating around, and if you want to peek at it afterwards again, that's fine. But you can use them for partial dentures, for full dentures. If you're having trouble keeping a denture in, or you know somebody that does have trouble keeping their denture in and stable so that they can chew properly, and that's a nice alternative. Now, there are certain assumptions that their health is good enough to handle it, that they have enough bone, things like that, and that you have their doctor, the physician's, blessing to go ahead and do that. But it's really a remarkable idea and a remarkable way to have people have a better quality of life. They can eat again. I mean, that's liberating. That's liberating.
Our dads did implants in the 80s.
Yeah.
And at that time, it was pretty iffy. You didn't know whether it was going to stay in. You didn't know if it was going to work. It was an iffy proposition.
It's brand new. Yeah.
But I also think back to a time when heart surgery, open heart surgery was iffy. They had DeBakey and Cooley, and these two guys in South Africa, and the guy from Houston, and they put everybody in the paper. He's having heart surgery, open heart surgery, open heart surgery. Open heart surgery is done just about every hospital in every state. That's no reason, and it's predictable. Somebody said, "Oh, so-and-so had a bypass." They don't even look up from the paper. That's nice. It's not that big a deal anymore. It's a big deal if you're the one having it, but it's not that big a deal. It's very predictable. Well, dental implants now are very predictable. They're inserted into the jawbone, and they hold something. They may hold a crown. They may hold a permanent bridge. They may help anchor a removable bridge or a removable denture. They can aid in many different ways. Now, traditional implants, which we still do lots of, you would put an implant in the jawbone and you want it to sleep for about 6 months. At the end of 6 months, you would uncover it and it would anchor something. A single crown. A series of them would anchor a permanent bridge. They would anchor a little snap that helped hold in a removable partial or full denture. The mini implant, which started as mini meaning diameter, skinny, is also being known as minimally invasive. Now, not to get too technical, but when you had a traditional implant, again, which we do and are wonderful, you make an incision in the gum is reflected, you expose the jawbone, a little channel of bone is removed, the implant is put in, you sew the gum, and you let it sleep for 6 months. A mini implant, there's no incision, there's no stitches, there's virtually no bleeding. A little skinny implant is just, you have a drop of Novocaine, and a little skinny implant is just screwed into the jawbone, and you test how tight it is when you put it in. It sounds gross, it's easy as pie. Easy as pie.
Doesn't bother me a bit.
You got one. Okay.
That sounds so easy.
And you test how tight it is when you put it in. If it tests to be a certain tightness, you say, it's ready to go. We can have it anchor something right now. If it doesn't test quite as tight, you say, we've got to let that sit for a few months before you put any pressure on it. Yes, sir?
What is the implant made of?
Titanium.
The question is, what is it made of? What is the implant made of?
What is the implant made of? Typically, it's titanium, and typically there is a coating on the outside, hydroxyapatite, I think is still, and that is something that bone likes. Bone looks at it and goes, oh, I like you, looks like me, and the bone will fuse to it over time. So the mini implant, whether you think mini in diameter or minimally invasive, is something that's done in an hour, less than an hour. Drop a Novocaine, no blood, no stitches, and it's either ready to go, ready to use to anchor something, a crown, a bridge, a denture, a partial, or you say, not quite tight enough, needs to sleep, just leave it alone for a while, that type of thing. But it has a tremendous advantage over the traditional implants in certain circumstances. I think the case selection is the key. There's no one tool that you can use for every job, and there's no one procedure that fits everybody under every circumstance. And the key is to understand, is this the right thing for you?
Questions?